The Greater Boston Food Bank starting a new campaign focused on the important connection between food security and health. Among the partners are Stop and Shop and Boston Medical Center. To tell us about the effort of the food bank is the CEO, Catherine D'Amato. Thank you very much for being with us, Catherine.
Thanks for having me.
First of all, this whole campaign comes after a study about that connection between food security and health. Talk about that.
Well, the Hunger to Health Collaboratory came together several months ago, but the first real sort of data effort to start to begin to understand this was a study that we did on the cost of food insecurity on healthcare. And that was $2.4 billion for the Commonwealth of Massachusetts. And what it does is it looks specifically at diseases. So it looks at poor health, pulmonary disease, it might look at diabetes, high blood pressure, depression, suicides. It takes into account productivity data as well as missed hospital visits, missed appointments. But $2.4 billion is the cost of food insecurity for healthcare in Massachusetts.
And of course, food security, it's in tandem with other things. You might have somebody who's scrambling to come up with the rent.
Sure.
Maybe there's a kid in the family who needs asthma medication, the prescription's not getting filled. I guess that must be part of it.
All those pieces, when you look at Massachusetts, 1 in 10 of our residents is food insecure, and 1 in 8, sometimes it gets as low as 7, is a child. So when you're thinking about what's my trade-off, right? Well, I only have so much money, and much of the cause of hunger and our poor health is combined to an economic issue, right? Do I have enough money to buy my groceries? Do I have enough money to pay for my health care? And so when families have to make decisions, there's often a trade-off. I'm going to take my food money and use it for rent, transportation, education, housing. It might be for my medicine, and in turn then I'm going to a food pantry or to a program to supplement that.
Now, you're a lot closer to this, but a lot of people watching the show might say, the economy is doing pretty well here.
Sure.
Why do we need to be more concerned about, helping people with food?
Sure. There's a substantial wage gap. There is no doubt about it. So if a family of 4 here, let's just call it Suffolk County, needs about $72,000 to $73,000 to live. Poverty is about $23,500. So you can't make up that kind of money. You can't go get another $50,000. You might go from 23 to 28 or 28 to 32 or 32 to 36, but you still don't have enough money. And when I talk about that number of $72,000 for a family of 4, that's a self-sufficiency. So that's paying your rent, putting gas in your car, food on your table. That's not going to travel or for what we might consider unnecessary. This is survival. So you begin to see that families are very pinched in terms of their ability. We live in a very high cost part of the country. It's high wage, but it's also high cost. So not everyone is benefiting from a robust economy.
Well, as part of the campaign, you recently had an event, and I guess you've also got some things coming after that. Talk about that trajectory.
Well, the Hunger to Health Collaboratory is looking at using data, awareness, and then policy, right, to advance and change that from going from hunger and health to how do you get from hunger to health. And Monday we kicked off the first of 3 series, and it was on the power of collaboration. And we were able to bring together a number of cohorts and thinkers and to bring folks together would otherwise not be in the audience. And the collaboratory itself is made up of folks you might not think about. How do you combine a Stop and Shop supermarket with a Boston Medical Center, with a Greater Boston Food Bank? We have Babson College, Good Housekeeping, the Museum of Science, McKinsey, Rasky and Company, and you put all those together and we each bring our assets. So Monday was really to begin the conversation. How do we think about collaborating perhaps in ways that we haven't before or with others that we haven't? And in the collaboratory, we want to bring all of our assets. So the Greater Boston Food Bank's mission is to end hunger, but I need some help. I need others to come with us, and by creating this Hunger to Health Collaboratory, we're going to begin to have these conversations, and then you eventually drive people's understanding that this is a significant issue. You can't have $2.4 billion in cost associated with food insecurity and not go, what? Mean there's an impact on our economy? Yes, there is. And we're the first food bank in the country to hire a doctor, to have an MD on staff. We've just hired an epidemiologist. That connectivity is real. That adage of food is medicine is real. And what we hope to do by embracing this is, how do you bring food insecurity forward to the public's understanding that this is an issue of public health? This is an issue where people are hurting, dying, and are sick, and how do we help them?
Here's one of the other things that maybe is not so dramatic, but it must affect a lot of people. I found shopping, if you want to buy food that's lower in salt, sometimes you got to pay more money.
Sure you do. There are the advantages of healthy food are just sort of that we know what they are, but the access, right? So there's expensive produce, fresh produce that might have particular nutrients, and there might be less costly produce. But what's that nutrient value? And yes, that is kind of ironic, where that value add is what it's seen in our country today. It's better for you, it has none of this and none of this, but it's a little bit more. That will even itself out in the food industry and in manufacturing. There are now more companies looking at organic and non-chemical sort of foods. If I look at the Greater Boston Food Bank alone, 10, 15 years ago, we had difficulty moving fresh produce. Today, we're moving 30% almost of our distribution. Now that's 20 million pounds of produce, fresh produce alone. The world has changed dramatically. Look at a grocery store. Look at the outer aisles. Those are all your fresh products that are on the outer aisles, produce being one, fish, dairy, eggs, milk. So they're growing, they're expanding. The consumer is aware of this.
I want to ask you about one other thing going on around your mission. The news is
Sure.
the Trump administration is tightening up access to government benefits for immigrants. I don't know if that's going to include SNAP benefits, but it looks...
Yeah, SNAP is in a huge position of threat. There's no doubt about it, as are many entitlement programs, especially for those who need our help in our country. And it's very draconian measures coming, but we should expect to see changes in the Farm Bill that's up for reauthorization this fall. And on Monday, we had Congressman McGovern at the Collaboratory event as well to talk about how do we prepare for this, or how do we fight for this. And we do need to fight. It is to stand up and say, this matters. This is a backbone program for the poor in our country and for the working poor in our country, people who are actually working. Food stamp is one of the most highly nutritious programs, not unlike WIC or school breakfast, school lunch, breakfast after the bell. All these programs are at a deep threat and uncertainty in our country right now.
We should mention, if people want more details about the Collaboratory or the food bank, there's a way they can look that up?
Sure. Go to gbfb.org for the food bank, and go to hungertohealthcollaboratory.org.
Thank you very much for being with us.
You're welcome. Thank you for having me.
Catherine D'Amato from the Greater Boston Food Bank.